ago, I was asked in one of those interminable university academic career building activities to come up with your soundbite. What describes your research narrative in, 10 words or less? So after grappling around for a while, I came up with the theme that most of my research coalesces around the relationship between science and technology and regulation and law. And the overarching feature of that relationship is that law and regulation is always lagging behind. We can do some incredible things, we're incredibly smart, but we're always playing catch up. And that law and regulation is incredibly important. It doesn't matter whether you're talking about non-fungible tokens and social media, big data analytics and surveillance, genomic regulation, the technology will emerge. And then law, regulation, governance, all those things that not only have prohibitory powers, but also have the ability to exploit the benefits of that technology and ensure their just and equitable distribution of benefits, is always playing catch up. The COVID pandemic illustrates that phenomenon writ large. What we're witnessing and living through at the moment is not a failure of science and technology. There have been some incredible technological breakthroughs that have taken place over the last 2 years, which I'll talk about momentarily. But rather what we're seeing is a failure of systems of law, of regulation, of governance, and of politics. One year, 10 months and 8 days ago, the Wuhan Municipal Health Commission issued 2 urgent notices about cases of pneumonia of unknown origin, linked to a seafood market in Wuhan province. The next day, Finance Signer, a Chinese business publication, reported on those notices. And that report, in turn, was picked up by several disease surveillance centres, including the Taiwanese CDC. They, in turn, notified the World Health Organization, triggering the surveillance reporting networks. Thus far, everything to do with that surveillance network had worked exactly the way it was supposed to. The idea is you have a network of nodes, all of which inform and reinforce and distribute those sentinel messages. Thus, the virus, which came to be known to all of us as COVID-19, was introduced to the world. In the time since that first Finance Signer report appeared, the virus has had a staggering impact. Nearly 268 million cases have been diagnosed, resulting in 5.3 million deaths, including tens of thousands of healthcare workers. Economically, COVID-19 is responsible for the largest simultaneous contraction of economies since the Great Depression and the greatest shock to the global economy since World War II. Global gross domestic product declined by 6.7% in 2020. And while there have been some signs of economic recovery in 2021, neither the impact of the decline nor the recovery itself have been evenly distributed across the globe. Developmentally, over 100 million people have been pushed into extreme poverty, often from existing poverty by the pandemic. Millions more girls are at risk of missing out on education and being forced into early marriage. The education of approximately 90% of the world's children has been impacted by COVID to some extent, and gender-based violence has increased in most jurisdictions. Our already reaching task of achieving the global development goals seems to be slipping further from our reach. In nearly every economy, those who are politically and economically most vulnerable, migrants, refugees, those working in informal employment, and those living in institutions, have borne the brunt of the pandemic's consequences. And as the recent emergence of the Omicron strain has demonstrated, we're not out of the woods yet. In fact, just last night, epidemiologist Eric Fageldang referred to Omicron as potentially being pandemic 2.0. Over that same period, however, we've seen remarkable things. By the 5th of January 2020, a matter of days since the doctors first sent samples from their index patient in China to a pathology lab for testing, Chinese scientists had uploaded a complete genomic sequence of the causative agent to GenBank, an open access genetic database accessible to researchers all over the world. 2 days later, the virus had been isolated, and by the 10th of January, PCR testing reagents had been developed. None of these achievements would have been thinkable within these timeframes 2 decades ago. Pre-COVID, it would have been similarly unimaginable to think that less than 2 years after the emergence of the novel pathogen, over 100 candidate vaccines targeting that pathogen would have been developed, and 25 of them would have received full or provisional authorisation for use. And again, in the overnight news feed, it's come out that we're going to start offering vaccination to children between 5 and 11 from the 10th of January. In light of these massive medical technological successes, and there have been many across surveillance and detection through the development of diagnostics, development in PPE, vaccines and supportive care, including supportive care to treat reactions and adverse events arising from some of the initial treatments and vaccines, how is it that our response to COVID has fallen so short? In May 2020, the World Health Assembly, via the Director General of the World Health Organisation, asked former President Helen Johnson-Sirleaf and former Prime Minister Helen Clark to convene an independent panel tasked with finding out. The result was the independent panel report, COVID-19 Make It the Last Pandemic, released in May of this year. The panel's methodology was reviewing literature from a range of disciplines and sources, conducting original research, interviewing thousands of people, from policymakers, politicians, frontline healthcare workers and others directly and immediately affected, via roundtables, panels and town hall meetings, inviting submissions and seeking out testimony. The outcome of this extensive consultation was a series of recommendations calling for fundamental transformation of global health systems. The report itself was supported by a raft of 15 sub-reports focusing on different aspects of the panel's inquiries. The panel found that national and global approaches to pandemic preparedness were uncoordinated and under-resourced, notwithstanding several previous epidemic warnings, including outbreaks of SARS, H1N1, Ebola, Zika and MERS. Indeed, the SARS epidemic prompted the 2005 rewrite of the International Health Regulations. It is a matter of some irony, therefore, that those very regulations were identified by the panel as part of the problem in failing to prompt states to respond adequately when COVID was first brought to their attention. But at least the IHR, International Health Regulation, reforms were addressed. Many other proposals for reform of global pandemic preparation frameworks, which emerged from a succession of 11 different panels after SARS, were never implemented. At the national level, the panel noted that pandemic preparedness was vastly underfunded, despite clear evidence that its cost is a fraction of the cost of responses and losses incurred when an epidemic occurs. Curiously though, the panel found that those nations which scored highly on self-assessed pandemic preparedness criteria did not necessarily benefit from reduced COVID death rates. And some obvious examples there include the United States, the United Kingdom, and much of Western Europe. A reason for this is that defects in the metrics used include a failure to account for a lack of access to universal health care and, importantly, a failure to account for the impact of absent or diminished trust in government, both of which played significant roles in determining the success or failure of countries in responding to the pandemic. Once the pandemic emerged, key findings of the panel include that the virus outpaced the surveillance alert systems, that those early responses lacked urgency and effectiveness, and that states failed to sustain their responses as the pandemic continued. Reading through the material presented by the panel to support these findings, three critical themes and motifs appear: time, both in detection and response; information, collection, communication, verification, dissemination, and action as well as absence, and equity of opportunity, of impact, and of access. Unsurprisingly, these themes operated both independently and interdependently throughout the period examined by the panel. The panel described February 2020 as a lost month. They noted that the World Health Organization was effective in rapidly detecting and disseminating information about the existence of COVID to countries via its surveillance networks. However, it was hamstrung in communicating the associated level of risk. And that hamstring was a consequence of the international health regulations. Rather than using the term pandemic, which at least had the benefit of conveying the urgency of the situation, the international health regulations refer to public health emergencies of international concern, shorthanded as PHEICS, which tend to convey somewhat less of a sense of an impending crisis. And indeed, it is without that sense of crisis that many states responded to the release of the PHEIC when it was eventually released by WHO on the 30th of January 2020, some 8 days after the panel originally found that it could have been released. That delayed response was not helped by the IHR's accompanying conservative approach to information. The international health regulations require positive information thresholds to be crossed in order for action to be taken, triggering of the release of the PHEIC, for example. This makes them ill-adapted for rapidly spreading highly transmissible respiratory pathogens like COVID, where the risk can vastly outpace the knowledge of that risk. In particular, the panel found that there is a case for applying the precautionary principle in any outbreak caused by a new pathogen resulting in respiratory infections, and thereby for assuming that human-to-human transmission will occur unless evidence specifically indicates otherwise. Significantly, this observation in itself has triggered widespread debate. The precautionary principle's meaning is not well understood either generally or within policy circles. Emerging from concerns around environmental harms, what it does is addresses gaps in existing knowledge and proposes that responses to unknown levels of risk should adopt a more nuanced analysis of risk-benefit analysis. In contrast, the precautionary principle by many has been interpreted to mean a risk-averse or a risk-conservative approach. And it's not until there's some consistency at all levels in interpretation of what exactly that means that it's likely to be much help in reforming the international health regulations. When issuing the PHEIC, the World Health Organization advised that human-to-human transfer was possible. The independent panel found that an alternative approach, advising countries to assume that human-to-human transmission would occur, pending the emergence of evidence to the contrary, may have resulted in better outcomes. Of course, information and its availability goes far beyond the example in the context of the pandemic. Social media has amplified the voices of skeptics and conspiracy theorists, aided and abetted by leaders who have publicly proclaimed untested remedies, decried public health measures, incited violence and protest. The vaccine hesitant, anti-vaxxers, COVID denialists, sovereign citizens, and other emergent groups who may be distrustful of government, science, or both, are being countered with increasingly stringent legal responses, including exclusion from public spaces, employment mandates, and other measures by government and public health officials frustrated by the perniciousness of COVID misinformation and its ability to undermine public health responses. There is a bittersweet irony that while some parts of the world are desperate to get vaccines into arms, others, including our own, are desperate to get the arms for the vaccines to go into. Something the pandemic has amply demonstrated is that scientists, public health officials, and others with evidence-based expertise need to become far more adept at communicating key concepts, including risk, to a population with ready access to information, but not necessarily the critical skills required to evaluate it. It is wholly unsurprising that equity has emerged as a key theme and motif in the report. While some of the critical issues related to time and information have been acknowledged are in the process of being addressed, inequity remains a critical sticking point, both as applied to individuals and communities within national populations and to nation members of the international community. Many of the speakers speaking on today's program will be addressing vaccine inequity in far more detail than I'm going to. However, the panel noted that the technological inequity between states extends beyond vaccines, encompassing equipment, diagnostics, testing reagents, PPE, workforce, advice, regulation and governance, and funds. Clearly far broader than the reporting currently evident on TRIPS waivers for vaccines alone would suggest. On the latter, it's perhaps bleakly amusing that the urgent calls made by the panel included that the World Trade Organisation and World Health Organisation facilitate agreement between major vaccine-producing countries and manufacturers to negotiate agreements on voluntary licensing and technology transfers within 3 months of the report submission. The alternative was triggering an immediate waiver of the TRIPS provisions. Noting that we are now well beyond that 3-month deadline, which I'll refer to momentarily, it seems safe to infer that not all the recommendations of the report have been adopted. So what were the recommendations? Key amongst them included better leadership and coordination at all levels, including increased independence of the World Health Organisation, negotiation of a pandemic treaty, and establishment of a Global Health Threats Council, responsible for maintaining preparedness and cooperation and coordination of responses and planning. The treaty, at least, is a recommendation that's gaining traction. Rhetoric has shifted significantly over the months since the report was published, and just last week, the World Health Organisation outlined an ambitious timeline for preparation of a pandemic treaty by mid-2022, to be presented for adoption to the World Health Assembly in 2024. It was with a degree of irony that I noted that one of the major medical research journals published an opinion piece this week titled, "Could Global Geopolitics Derail the Pandemic Treaty?" An optimistic interpretation of it to anyone who's ever watched one of these things being produced. Other recommendations include investment in preparedness, funding access, improved surveillance and alert systems, including reform of the international health regulations, and establishment of a pre-negotiated platform for production and distribution of essential supports, including those vaccines, diagnostics, therapeutics, and other supplies, as global common goods, thereby seeking to avoid some of the monopolistic behaviours that have been evident today. In November, the chairs of the panel provided a 6-month update on the progress of the report. Their assessment was described as blunt. The report was titled "Losing Time." The update noted that some progress had occurred, but it was neither fast enough nor cohesive enough to bring the pandemic to an end in the near term. In particular, they noted that only 25% of the vaccine they had called for to be redistributed to the world's poorest countries had been, and that deaths in those countries remained high while vaccination rates remained low. They reiterated calls for the establishment of the Global Health Threats Council and their calls for increased financing and governance. Additionally, they reiterated their concerns about voluntary licensing and technology transfer, stating global health cannot be left hostage to a pharmaceutical industry which buys up patents and develops them in the interest of making profits. So nearly 2 years into a pandemic, what do we know so far? Well, firstly, we know that it's not a pandemic born of technology failure. The technological advances and achievements today have been nothing short of breathtaking. It is, however, a pandemic of global systems failure. The interaction between institutions, legal frameworks, and geopolitics has shown in stark relief some of the limitations of the existing status quo. We also know that we need to rethink our relationship with an emerging class of international megacorporations. Some of the strongest players in this particular situation have included social media companies, providing platforms for dissemination of misinformation, big pharmaceuticals who have benefited from public funding and then retained the entirety of the profits they've made, and other big tech companies, some of which exercise more power and have larger financial resources than some economies in wielding their power, often harmfully. It will indeed be interesting to see what the next 6-month report may bring.